Good morning, Erie. It's Friday morning. I'm Jocelyn Person, filling in for Dave Belmondo this week. Or should I say, just today?
Just today, today's the last day. Last day. You go back to your mundane job as a reporter after.
Out in the field. It's going to be raining next week.
Yes, doing your thing. Well, you know, Monday should be fine. Even Tuesday morning. Yeah, Tuesday morning shouldn't be bad.
Okay.
Yeah.
Okay.
After that,
I trust you, Tom.
After that, well, we just don't know.
Good luck to me.
Yeah. But again, great weather, and get out and enjoy. Weather looks pretty good.
Thanks, Tom. Well, President Trump is now threatening to overrule the FDA if he does not approve of the FDA's tougher guidelines on a potential vaccine.
And some states now say they'll have their own review of the vaccine. Here's ABC's Mary Bruce.
After touting a coronavirus vaccine by Election Day, President Trump is now threatening to reject stricter safety standards that could slow down its release, once again undermining his own health officials.
Well, I tell you what, we're looking at that. That has to be approved by the White House. We may or may not approve it. That sounds like a political move. 4
vaccines are in their final trials, but new rules from the FDA would reportedly require drug makers to monitor trial volunteers for an additional 2 months. Dr. Anthony Fauci coming to the FDA's defense.
If they look at it and say, we really feel strongly we should go this way, I would back the scientists. I would have to do that as a scientist.
Fauci said they may not need the additional monitoring if the vaccine is overwhelmingly effective, but stressed if they go ahead with it, it is only to ensure the safety of the vaccine.
To get rid of completely any further waiting for safety, I think most scientists would say no. You really got to be careful.
The FDA declined to comment on the president's threat, but just hours earlier, testifying on Capitol Hill, the FDA commissioner was adamant they are being guided by science, not politics.
Our thorough review processes and science will guide our decisions. FDA will not permit any pressure from anyone to change that.
A vaccine could be authorized as soon as next month, but it is not expected to be widely distributed until next spring. With concerns that the White House is increasingly injecting politics into the pandemic response, New York announced it's going to conduct its own review of any vaccine.
Frankly, I'm not going to trust the federal government's opinion. And I wouldn't recommend to New Yorkers based on the federal government's opinion.
At least 5 other states and Washington, D.C. have also said they would conduct their own evaluations before distributing a vaccine. With 202,000 Americans now dead, officials are predicting up to 23,000 more dead by mid-October. And now we're learning about a large study out of Houston that is not peer-reviewed, saying the virus mutated and could be more contagious. But so far, there's no evidence it's more deadly.
That was Mary Bruce reporting. The latest COVID-19 numbers for Erie County have been released. The Erie County Health Department reporting 10 new cases and 54 active cases Thursday. 1,514 people have tested positive since March. 51 people in Erie County have died from COVID-19. Another 17 people have died from COVID-19 in Pennsylvania. Now that total now is 8,079. Another 853 additional positive COVID-19 cases also reported yesterday, for a statewide total of more than 153,000. In Crawford County, the state has reduced the total by 1. It's now 297. Warren County and Chautauqua County are unchanged, and Ohio is reporting 2 more cases in Ashtabula County. As the number of COVID-19 cases inches up, the best advice for staying healthy remains the same. Now, this week, Governor Tom Wolf and state lawmakers have battled over business restrictions and crowd sizes at events like high school football games. Last night on Jet 24 Action News, epidemiologist Emily Shears said if you go out, it's still best to socially distance yourselves, wear a mask properly, and wash your hands. And although the U.S. has more than 200,000 deaths, Shears also points to our case fatality rate.
We are ranked 11th worldwide, much lower at 2.9% than some countries like Mexico and France, which are at 10% and 6%. And really that measures the percent of individuals with COVID that do pass away from the disease.
The state continues to use technology in the fight against the COVID-19, and this week they released a COVID alert app that can notify users if they may have been exposed to the virus. Brian Wilk explains.
The COVID Alert PA app was developed by the State Department of Health, and its features include an interactive COVID-19 symptom checker and an opt-in alert for potential exposure to the virus.
So it's basically an added level of helping the contact tracing process to limit the spread of the virus. So the more people download the app, the better we are doing our duty to our community and helping our contact tracers to limit the spread of this virus.
The app keeps the identity of its users private. It does not use GPS, but a technology that will let you know if your phone is within 6 feet of another person with the app.
Technology is helpful. Trust this technology, especially you are not giving any personal information.
We talked to one Erie resident who says technology is a good thing when it comes to the fight against COVID-19.
Technology is amazing, and we need to use all our resources to track who's exposed and also to notify people so that they know that they've been exposed as well.
The app can be found in the Google Play Store and the Apple App Store. Brian Wilk, Jet 24 Action News.
According to the state website, over 50,000 people downloaded the app in the first 24 hours. Now is the time to consider getting a flu shot. Experts say this year it's more important more than ever before. With the pandemic, preventing the flu is crucial this season. WeCom once again this year making it easy to get a flu shot. Last night we held our annual flu shot phone-a-thon, answering questions about the flu. To get a flu shot, all you need is a driver's license and insurance card, but things are a little different this year with drive-through services.
The way that we have the clinic set up, we're doing a lot of drive-through sites and a lot of things keeping in mind social distancing, not the large health fairs that people are used to. Most insurances cover it as just a wellness because it's something that's suggested to get, so it's usually a wellness with no copay on most insurance plans.
For more information on where and when you can get a flu shot at the drive-through clinics, just go to yourerie.com. A nurse who served the Erie community for more than 6 decades is honored for her service. Joanne Trahusky retired right before the pandemic, but was a nurse at UPMC Hammett for 61 years. She graduated from the Hammett School of Nursing in 1959 and says she wanted to be a nurse since she was a little girl. To honor her, a scholarship in her name was dedicated to future nursing students. Joanne had some advice for future nurses.
Work hard, learn as much as you can, always respect your patients and those who work with you, because you cannot do this job alone. You have to be part of a team.
2 years ago, Joanne was given the award for commitment and excellence in service, one of the UPMC's highest award. Time now is 6:08. You don't want to miss our picture-perfect weather and the trivia questions next. Stay with us.
From your news leader, you're watching David Belmondo, meteorologist Tom DeVecchio, and Jay Pushkar with sports. This is Jet 24. Good morning, Erie.